Hello, I am Jillian Gordon. I'm here to present my findings in my work, The Relationship Between Grimace Scale Expression of Dairy Cattle and Post-mortem Dental Health and its Implications for Welfare. Little is known about dental health in the UK dairy herd, so this is an overall review that assesses the current state of the industry in terms of dental health of dairy cattle. We use the tool called the Grimace scale. This is a novel tool that has been used to identify pain in cattle, though it's still very much in its initial phases. Dental health in dairy cattle is poorly understood, and a lot of the dental health is compared to equine health rather than having their own set of regulations. When I asked a farmer at the start of this study if he ever evaluates dental health, I was shocked when he said the only time he ever looks at the teeth is when he finds them on the parlour floor. This really indicated the severity of the issue for me. So in this study, we looked at 10 cows selected by the farmer for culling under norm farm management for a range of reasons, mastitis being barren, lameness, things like that. Each animal was physically examined and live data was collected, including body condition score, lifetime data yield, lameness score, and the Grimace evaluation was taking place. The 10 cadaver heads were then collected from the abattoir, and the physical assessment of the dental conditions were conducted. 3 heads, the best, the worst and the average head, were sent for CT scanning, and all the dental health conditions for each cow was collated. So the results of the study. Every single cow in our study presented with a condition called whaled mouth that you can see in image 1. This is when there's a rise and fall in the line of the teeth that should be straight, and this can create to sharp edges and is known in the equine industry to have other consequences such as impactions and abscesses. The abscess shown in image 2 was found in cow number 7. As you can see, it was quite a significant discoloured area and had formed in a large diastema. This abscess was actually so significant you can see in the larger of the boxes on image 3 how much it has eaten up into the tissue above the jawline there. If you scan this QR code, you'll be able to see a video of this cow chewing, as in the live animal assessment it was noticed that they had a very strange chewing motion and there was some dark discharge coming out of the nasal passage, corresponding to the side the abscess was on. This indicated that it was quite a painful condition and was obviously causing some discomfort in the live animal. The results of the study was that there was no statistical significance found between the mean dental health and the Grimace scale of the animals. This could have been because these were cull animals and we were unable to identify the main reason for their pain. So though they were experiencing pain, how did we know that it was their dental health rather than their lameness or chronic mastitis, things like that? So future work should be done in this area to develop it. We were also able to create a trident dental chart. Now this wasn't conditioned for dental health of dairy cattle or for cattle in general, though we have it for every other animal including hamsters and sheep and equine. So this is the one that we were used and further developed throughout the time of doing this experiment. We hope that this can be used for industry and for education purposes. From this study, we conclude that the presence of dental health concerns is endemic in the sample population of dairy cattle, with all of the cows being affected in some way. And from this, it is reasonable to hypothesise that the dental health conditions may be affecting the wider cattle population, though obviously more research is needed to confirm this. The Grimace scale evaluation was not able to define the presence of dental health concerns, though as stated before, this could have been because of the small sample size and the other possible conditions of the herd. But overall, this study highlighted the need for further research into dairy cattle dental health and cattle dental health in general. And though this is a small sample size, the results were quite alarming. I would like to acknowledge my supervisors on this project. They were all absolutely fantastic and really helped develop this. I would also like to acknowledge the staff that helped, being that with the International Animal Welfare and Ethics team at Edinburgh Uni, the CT scanning team, the Royal Cronted Farm SRUC, and the Royal Dick Veterinary College Administration team and post-mortem team, as well as everybody else who was involved from the abattoirs all the way through to the statistics side of things. I would also like to thank massively the Animal Welfare Foundation for helping fund this project, and the University Federation for Animal Welfare, who were also involved in funding this project. I'll have time for any questions. Thank you very much. If you have any questions, please contact me on that email there or in the breakout room shortly.